Hello and welcome to Good Life the Health Show with me, 𝗚𝗢𝗙𝗓 𝗦𝗃. Well, viewers, today I have with me Dr. Gurpal Singh, orthopedic surgeon at Mount Elizabeth Novena Hospital and Parkway East Hospital, Singapore. So first of all, welcome to Good Life the Health Show, Doctor. Thank you so much for joining us today.
Thank you for having me. Thank you.
All right, so first of all, Doctor, what distinguishes robotic-assisted joint replacement surgery from traditional methods?
It's a fantastic question. I'm happy that we went straight to the point.
Yes.
So, I'd like you to think of joint replacement surgery as a journey. Now, I'll give you a simple example. Do you prefer to have a tailor-made dress, or do you prefer to go and buy something from the shop and choose between sizes?
Yes.
And sometimes when you're in between sizes, you know, sometimes the sleeve may be too short, or sometimes the dress may not fit you. I'm sure you've had this experience.
Yes.
Then I'm sure you have not been too happy. So the first example where we're talking about tailor-made dress is an example I'm sharing. Now this is a direction. Individualized surgery or customized treatment is the direction in modern medicine. So knee replacement surgery is not an act of going to the doctor and just putting in an implant. It's a journey. So a 55-year-old patient who's a retired national level athlete, still very active, wants to cycle 100 kilometers a week, has burnt out knees, is a very different patient from an 85-year-old lady who's got arthritis but is, basically homebound, needs to stay within the house and has a lot of pain.
Right.
If the same strategy is used for both patients, either one of them is going to be very unhappy. Cultural needs need to be respected. For example, prayer positions, kneeling, like example, namaz. And in Indian traditions, many prayer positions involve kneeling. People want to do yoga. People want to exercise. So nowadays, knee replacement is not just an act of, okay, you cannot do this, you cannot do that. You slow down, I replaced your knee, and then you just go for a walk every day. No. We have a lot of patients who are young, in their 50s, 60s, have arthritis, but are still very active, and they want to go hiking, they want to do all the things I just talked about. So we have to first have the conversation with the patient and understand what are your needs, what are the patient's needs. That is a very, very important conversation.
Right.
I am coming to robotics, and I'm not getting distracted, but robotics is just one tool that in this whole process of making knee replacement an individualized journey. The first most important thing is that conversation, and now once I understand what you want, if you are an avid yoga practitioner and you tell me I want to sit cross-legged, I want to do all this, gone are the days where we'll tell you, you can't do that after surgery. But we will have a conversation and say, look, yes, we'll get there, but this is what it takes. Okay? So the next thing is something called prehabilitation. Prehabilitation means even before you start the journey, we need to look at your muscles, have a physiotherapist who's subspecialized in these things, work with you, try and build up some muscle mass before we get to the surgery. Now, the surgery itself. If I were to give you a very simple example on robotic versus this thing. You got a mobile phone with you?
Yes.
Let's do an exercise. Let's put that mobile phone here on this surface, okay? And I want you to tell me, give me 30 degrees. Show me what is 30 degrees. Then I want you to give me 40 degrees towards yourself.
Okay.
And now let's say 20 degrees in this plane. Okay. So what did you just do? Are you really sure that's 30, 40, 20? There is no human being on this planet that can tell you that's 30, 40, 20. You just did an exercise of estimation. What I tried to illustrate to you is we as human beings, our senses are very limited. An eagle has a better vision than us. I know it's not nice to hear this. A dog can smell better than us. An owl can hear better than us in terms of frequencies. So what I try to illustrate to you is that if I'm going to now start making the cuts in the knee. I may have done 1,000 knees, and then based on my experience with 1,000 knees, I will have a very good idea of estimation. That means my estimating abilities would be very sharp, but can I really see that I'm getting that degree, that millimeter that I want, that precision? There's no way my eyes can see that. So robotic surgery is basically an exercise where even before we do the operation, we do a CT scan of your knee.
Yes.
We feed that CT scan into the robot. We have no two knees are the same. So we then have a very good idea what your knee anatomy is. Now we plan the surgery and execute that plan on the operating table to that millimeter and degree precision using the robot. The surgery is exactly the same. I do the surgery, but when it comes to the cuts, the robot is helping me to do the cuts. And if I'm not in that position that I need to be, I hit an imaginary wall. That means I cannot cut in any other direction.
Okay.
And this is something, but the surgeon still needs to be in charge. So that is it's basically an exercise of, you see how this is all leading up to individualized medicine. We had that conversation. I understand your needs. If you now need to sit cross-legged and do yoga and you're not willing to give that up, then I'll need to plan your knee a certain way. I get an idea of your knee, exactly what your knee structure is. Then we plan the surgery. Now we plan the surgery with the patient in the clinic, and we show the patient this is exactly what's going to happen, the implant, how it's going to be, and then the actual surgery is an execution of that plan with that precision. So it's a bit like me wearing some very fancy, I'm just giving an example.
Yes.
You feel like you're wearing some 3D, 4D glasses and doing the operation, because I can see those numbers, 1 degree, 2 degree, 3 degree, 13 millimeters, 14 millimeters, how much I'm cutting. So my eyes become sharper, my senses become sharper. And that's the real purpose of technology. The purpose of this technology is to make me a sharper surgeon. It's not an autopilot process where I'm sitting in the coffee room and then I just say, okay, now the robot does the surgery. It doesn't work that way. So the robot makes me a sharper surgeon and helps me to execute that plan that was made for you, for the patient. Now after the surgery, of course, when you're doing this with robotic surgery, the surgery itself becomes a smaller surgery, not in terms of the scar, but in terms of the cutting, the muscle cutting, the bone cutting. It's less traumatic. And as a result, translates to faster recovery. Hospital stays are shorter. And with the use of targeted pain management techniques like nerve blocks, basically injections around the nerves, you can achieve a fairly painless procedure. Analogy that I'll give you would be, childbirth. Traditionally has been a very painful process.
Right.
But with epidural analgesia, the game changed. When I was a trainee, if there's, from the labor ward, 2 miles away from there, you can hear screaming. But now, when my own children were born, I myself was surprised. I've done gynecology a long time ago, and epidural analgesia, you see ladies on the laptop now, just before the child is born, they're still doing their work and all that. So I'm just giving this as an example.
Yes.
So knee replacement surgery was like that in the past, where it would be a very, very painful process and morphine pumps were needed and all that. But those things are gone now because we use targeted nerve injections and these kind of pain management techniques together with technology like robotic assistance make the surgery very manageable. And the day, it's quite common that on the same evening, after the surgery is done, patients having a nice dinner, having a chat with the family, doing a video conference with the family overseas, and it's a very pleasant experience, not a very unpleasant experience, provided all these things are done. And these things need to be done by the specialists, not delegated to some junior member of the team and things like that, because then problems start to happen. So we need to be delivering to our patients what we promised, and it should be the senior member of the team that is doing that, because then the outcomes are very predictable.
Right.
Yeah. So then the hospital stays typically are 2-3 days usually for a knee replacement. And if the surgery is done in the morning, we walk you in the evening. Otherwise, if the surgery is done in the evening, we walk you the next day. And once you can do one round around the ward with a walking frame, 3 days you go home. And usually by about 2 weeks, the wound heals. And at 2 weeks, we'll wean you off your frame or your crutches or your stick. And we'll between 2 weeks to a month, you will be walking independently. And at 1 month, you're back to whatever you want to do, office and stuff like that. And then we start, at about 2 weeks, intensive physiotherapy then starts, muscle building and all that. And then again, the focus is towards what you want to do.
All right.
So the two things we stop you from doing are basically a very deep squat and jumping on the knee. Besides these two things, like running or jumping on the knee and a very deep squat, besides these two activities, most other activities we don't really stop anymore. We allow you to do them, but there must be a process towards getting there.
Yes.
And we must understand your needs right from the beginning. So you see how this whole thing, you asked a question about robotic assisted surgery, but the real question is individualized surgery versus a one-size-fits-all approach.
Right.
The ready-made dress and the tailor-made dress.
Right, doctor. So it's quite different from the traditional method. All right, so doctor, we'll talk more on this. So viewers, now it's time for a very short break. Don't go anywhere. I'll be right back. Welcome back. You're watching Good Life, the Health Show with me, 𝗓𝗙𝗓𝗓 𝗦𝗂𝗙. So doctor, as we are talking about robotic surgery, now I'm sure our viewers would like to know what are the potential limitations or challenges associated with robotic assisted joint replacement surgery.
Sure. Fantastic question. Machines are machines. And even the best machine can potentially fail.
Right.
So the captain of the ship is still the surgeon. And the surgeon needs to be able to bail out in case technology fails, i.e., the surgeon should be able to seamlessly transition to doing conventional surgery if there is a need to. However, this, touch wood, has not been, I have not had any experience where, I've had to do that. But in the training for robotic surgery, we have to, just like how a flight crew will train, we have to train for all of these possibilities. So what is dangerous is if you start training, like the newer generation of surgeons, you start training only on robotic surgery, and you do not know how to do a good conventional knee replacement, that's dangerous.
Okay.
So a surgeon should be able to manage both situations and yet give the patient a good outcome. Openness of conversations and communication is very important. We need to tell the patient that there is perhaps a 1% or less chance that this situation may arise. If it arises, we will be able to complete the surgery safely and with no compromise in clinical outcome. Of course, the robotic part may not be there, but we need to be open about these things. We also need to understand that the robotic surgery is going to be as accurate as the CT scan and the data that's fed in. So there are protocols and very strict protocols on how to do those CT scans. It's not an act of going to any radiology facility, any CT scan center and getting a CT scan. The radiographers are trained specially that the leg has to be in a certain rotation and all that kind of stuff when the CT scan is done. There are technicians who then work on that scan with us and then we plan the surgery. So at any point in time, if the planning is not done properly, the CT scan protocol is not done properly, that is actually more dangerous than the machine failing. The machine almost never fails, but we are always prepared for it to fail. If it does, we know what to do. So the surgeon must be trained to do a good conventional knee replacement and not just rely completely on robotic surgery. And the more important thing is the planning. and all these steps that we talked about. So they need to be executed properly. It cannot be an act where the surgeon looks at the scan for the first time on the operating table, then that's going to be disaster. Everything is in the planning. The planning is what takes the most effort. And this is exactly what I tell the trainees and the doctors who are learning robotic surgery. Plan, plan, plan. All the thinking needs to be done before the operating room. When you're in the operating room, it's an exercise of execution. And you need to have plan A, plan B, plan C, plan D, all worked out before. Never walk into the operating room unprepared. Yeah, it's all planning is the most important thing.
Right.
Yeah.
All right, doctor, now I would like to ask you about healthy bones and joints. You know, how to age gracefully and get healthy bones and joints. So please tell us about that.
Okay, that's an excellent question. So let's think of it as what we can, there are certain things we can modify, there are certain things we can't. So what is not in our control is genetic makeup. We can't modify the bone structure that we have been given.
Right.
So if there is a very strong family history of arthritis, for example, then the individual is more likely to get arthritis in his or her lifetime. So that's something we need to understand. Now, in terms of what we can modify or control, are environmental factors and how we treat our bodies. So obesity is one of the most important issues that we're dealing with regards to early onset, problems with the joints. Weight management is crucial, and it's not simply an exercise of saying that, okay, you need to manage your weight, you need to eat less. Sometimes help from experts is necessary, where metabolic rates need to be looked at. Is the individual having thyroid problems? And sometimes professional help is needed to deal with this weight issue. So weight management is crucial. Right. The second thing is lifestyle issues, smoking, excessive alcohol intake, nutrition issues, not having enough vitamin D. People tend to overdo the calcium. Our body has a very tightly regulated calcium control. So usually overdoing the calcium doesn't help. If we are getting sufficient amounts of it in the diet, of course, if the diet is not having enough, that's a different story. But generally speaking, if your diet is balanced, and you have a sufficient amount of dairy and you're not allergic to stuff and you're not lactose intolerant, you should have enough calcium in the diet. Right. The issue is usually vitamin D. Not having enough sunlight exposure, and even if you have sunlight exposure, we cover ourselves, so only the face and the hands get the sunlight. So usually vitamin D supplementation is necessary to some extent, but not in everyone. It should be done in a targeted way. Blood levels should be measured, and it should be looked at and should be supplemented if needed. So healthy diet, we touched on that. The vitamin D is important, and bone health, especially in ladies once they are menopausal. Bone mineral density measurements should be done, say, every 2 years. Right. And early onset osteopenia and osteoporosis should be detected. Fall prevention. The second main category is muscle. Not letting the muscles become too weak. This is a condition called sarcopenia, where in old age muscle wastes away. Again, to some extent it's genetic, but poor diet, lack of exercise is very important in contributing to that. So keeping the joints moving, having physical activity is very, very important for healthy bones and joints. If the bone and joints they are not loaded, and if you're sedentary and you're just in bed, or if you don't do very much, especially in the older years, that is the worst thing that you can do. The problem is health-seeking behavior needs to be awareness needs to be created. Right. Because people tend to get joint problems, wear and tear, early arthritis, and they don't get help. So they let this progress, and then the mobility comes down, muscle loss kicks in, bone becomes weaker, and then there comes a point of no return when the individual seeks help. Then you need like fairly extensive surgery, the surgery doesn't have good results because we basically passed that point where we should have gotten help. So my point is, if people are having joint issues, get help. Don't dismiss that as aging. Joint pains should be assessed by the specialists. Proper workup should be done, and if that is treated at the right time, with or without surgery, then mobility should be maintained, independence should be maintained as much as possible, and then all these issues can be slowed down.
So basically it should be a good lifestyle,
Yes.
Healthy food and
Yes.
maintaining a balanced lifestyle,
Yes,
isn't it?
exercise, mobility, and treating joint-related pain early on time.
Right. So now, doctor, let's talk about sports injuries. What
Yeah.
are the landmark breakthroughs in sports injuries? Can you please elaborate?
Sports injury is something very close to my heart again, and there are again two aspects to this question. One is the prevention of sports injuries and optimization of performance in an athlete or sports person. The second part is, when a sports injury happens, it needs to be dealt with in a timely way and addressed quickly. So in a competitive athlete or a sports person, the classical sports injuries would be meniscus tears in the knee, ligament tears, and the approach in someone who is playing for the country, for example, is that the person is seen immediately, the scans that are done, injuries diagnosed, early surgery. Again, the concepts we talked about earlier: prehabilitation, surgery, post rehabilitation, individualized medicine, 6 months, return to the season, play again. That's the but unfortunately for most other average human beings like us, who have day jobs, responsibilities, when sports injury happens in either one of us or in our children, we tend to neglect it. And that is the worst thing that can be done. Neglecting a sports injury, and if that injury doesn't heal, it sets in place a whole mechanism of problems, a whole cycle of problems that eventually leads to early onset wear and tear, early onset arthritis in that individual, which then is irreversible. So the breakthroughs in sports injuries, if you want me to tell you the glamorous stuff, would be arthroscopic surgery, keyhole surgery. Most methods of dealing with sports injuries are now keyhole methods. We can do cartilage reconstruction. There are methods of patching up your cartilage. Meniscus repair has evolved. We hardly shave away and cut away meniscus. Ligament injuries, keyhole methods. You get availability of, you can use your own tendons, or you can get allografts to, reconstruct your tendons. These are all the fancy stuff. But these are all surgical techniques. Rehabilitative techniques have evolved. So if we deal with that injury on time, you're almost always assured that you will play again. But the real problem is never the glamorous stuff. The real issue is always neglecting or getting the wrong advice and saying, running away from surgery when it's needed, and then presenting late and passing that point of no return, where muscles are down and the injury is no longer. If you don't operate on that injury on time, you will not achieve that outcome that you could have achieved when the injury was fresh. So that's the real problem. And it's usually a mindset that needs to be changed. You can have the best advances in terms of surgery, but if the health-seeking behavior or the mindset of the individuals is not towards, it's a bit like saying you can bring the horse to the water, but the lake is there in front of you, but if the horse doesn't want to drink, then you can't do anything. So that's where the real challenge is, in my humble opinion. But the breakthroughs are mainly what I told you. I mean, there's a lot of advances in this cartilage repair techniques and reconstruction techniques and all that. And we pretty much can deal with most things with a keyhole approach or arthroscopic approach. But that's the technical part of it.
All right. So Dr. Singh, thank you so much for joining us today in Good Life,
Most
the Health
welcome.
Show.
Thank you.
All right. So viewers, that's all we have in this episode of Good Life, the Health Show. Keep watching Northeast Live. Goodbye and take care.